Hello again, everyone, and welcome to another episode of Resilient Health Radio. I'm your host, Dr. Darin Ingels, and joining me on the podcast today is Dr. Nalini Chilkov. She is a doctor of Oriental Medicine and licensed acupuncturist in Santa Monica, California, so just up the road from me a spell. She is the creator of the Outsmart Cancer System, the author of the best-selling book 32 Ways to Outsmart Cancer: How to Create a Body in Which Cancer Cannot Thrive. She's been featured in Suzanne Summers' very first book on cancer, I believe. She's been featured on WebMD and NBC, and she's a great educator. And I'm just so thrilled. I actually had a chance to spend some time with Dr. Nalini about 6 weeks ago at a retreat and really got to know her. So you're in for a real treat today. So, Dr. Nalini, thank you so much for joining us on the podcast today.
Thank you so much for having me, Darin.
So, you have been working in the integrative oncology or cancer care for quite a while, and you're so well connected with, I love the fact that you're connected with conventional oncologists, integrative practitioners. As an acupuncturist yourself, you come from the Chinese medicine perspective. There's so much to unpack around cancer, but October is Breast Cancer Awareness Month, so I'd really like to talk today specifically about breast cancer. But I think so much what you're going to share is really applicable to other types of cancer. And I want to kind of start off just talking a little bit about the connection between breast cancer and inflammation, because I don't think people, when we talk about root cause, what is it that triggers it? We can talk about some of the genetic stuff, but I think this inflammatory process is a big driver. Can you talk a little bit about your experience with that?
Absolutely. So, one of the things we think about in a health model for cancer is, while the oncology team is fascinated by your cancer and your tumor and your cancer cells, what we want to also take into consideration is the body that's hosting that cancer, the body that is making a permissive environment for cancer to develop and grow and spread. So we need to be like whole biosystem oriented. And so one of the factors we look at and what we call the cancer terrain, kind of thinking about the soil in the garden, and if you change the soil, you change what grows
Right.
there. So similarly, one of the factors in the cancer terrain, one of the big factors is inflammation. And why is that? So, first of all, if you have in your host biosystem, if you have a lot of inflammation, then you have an environment that is more hospitable to the development and progression of cancer. And then on the other side is cancer itself is an inflammatory syndrome. And many of the therapeutic treatments for cancer are pro-inflammatory. So we have inflammation to deal with in all those sort of phases that we need to think about. But the underlying principle is we need to get control of inflammation. And so if there is more inflammation, we'll likely have more cancer and more aggressive cancer. And so if you're already healthy or if you have a risk and you want to prevent cancer, your goal is to create a lower level of inflammation in your body. But if you do have cancer and you're undergoing treatment, you also need to do that. So this is a home principle. So there are many very basic ways to approach that. And one of the most important is what kind of a diet are you eating? Because it's very easy to eat an anti-inflammatory diet. And that is basically one of the principles of the Outsmart Cancer diet, which is to have a plant-strong diet that will always be inherently less inflammation, and to have a diet that is free of environmental and additive and fake chemicals and sweeteners and colorings. And we want to eat organic. And we want to have a wide range of colors in our plant strong diet, because it is all those plant pigments that actually, the color in food, that actually talks to our genes and can have what we call epigenetic influences. We can turn genes on and off. And so we want to eat a diet that turns on cancer suppressor genes and turns off cancer promoter genes. So being plant strong, eating lots of color, and when you're plant strong, you also get a lot of fiber. And when you have a lot of fiber, number one, you're going to have a healthier microbiome in your gut. We know that having a healthier microbiome transforms our immunity and our inflammation control. But we also know that a healthy microbiome causes people to be much more responsive to cancer treatments such as chemotherapy and immunotherapy. And we also know that patients who undergo surgery have far less complications if they have a healthy microbiome. So the microbiome is really important to inflammation control, but these other immune factors as well. And then one of the other really big pieces of controlling inflammation through diet is having a lot of healthy fats and oils in your diet. And so that means mostly high omega-3 oils and omega-6 oils to a lesser degree. So if you're eating a plant-strong diet, you're going to get more nuts and seeds, and you'll get oils from that. Those are mostly omega-6. So we need to put in a more emphasis on omega-3 oils. And those mostly come from animal sources like cold water fish, like salmon and sardines and cod and herring. And so it's important to get those. And the truth is, in the modern diet, we just don't have a lot of great sources. So I always include an omega-3 supplement as well, anywhere from 2,000 to 5,000 milligrams a day of that. Those
Yeah.
are the main things to really, the big levers for lowering inflammation through diet.
Yeah, I just want to add, when it comes to fish, we know that a lot of fish are contaminated with lead and mercury. So eating the smaller cold water fish is generally preferable. And I just want to caution about farm raised fish. Although it might
Absolutely.
be lower in lead and mercury, it tends to be high in PCBs and other cancer causing chemicals that we're trying to avoid. So just, the EPA actually puts out guidelines on the safer fish. But if you're eating a can of tuna every day, that might be a problem.
That's right. And where we live, there's a little app that tells you what local fish are the cleanest and healthiest, least contaminated to eat. So I imagine that applies to different parts of the country as well.
Can we talk a little bit just about genetics quickly? There are certain genes very much with breast cancer that have an association. People have probably heard about this BRCA gene. Can you talk a little about what the gene is and what that means for people if they test positive for that gene?
So the BRCA gene has been, it's kind of in the news when a celebrity has BRCA related cancer, it's in the news.
Yeah.
But the BRCA gene is a gene that actually causes your cells to not be able to protect themselves from oxidative stress and radiation. So this means that the DNA is less protected, and therefore the DNA can be more readily damaged. And not all, but one of the causes of cancer is damage to our DNA, and then sort of the blueprint of the cell goes haywire and you have an abnormal or aberrant cell. And the BRCA related breast cancers, and BRCA is also related to ovarian cancer and colorectal cancer and pancreatic cancer. It's related to other cancers, but they tend to be quite aggressive. They tend to have onset early in life. If that gene is carried in your family, you probably know a relative who has died of cancer. So it's usually not mysterious within a family, but if anyone is diagnosed with breast cancer, they should be assessed for the BRCA gene. It should be routine. And as an educated patient, you would want to ask for that assessment if it has not been offered to you. However, the BRCA trait is only 5% of all breast cancers. So it's actually rather rare. It just gets a lot of press. So everyone diagnosed should be fully assessed genetically. And so the truth of the matter is that almost all diseases, including cancer, have many, many genes that are
Right.
contributing to them. It's not just one gene. And so I think it's important to understand that, but if you are BRCA positive, you absolutely need an integrative approach, and you need a plan to also better protect your cells from oxidative stress. Very important. So just going back to a simple way to do that, you want to eat more color in your diet. That will protect you from oxidative stress. But if you have the BRCA gene, you also don't want to have a lot of medical x-ray exams and that sort of thing. You want to be very, very careful in the sun. You're more susceptible because your cells cannot protect themselves from radiation and oxidative stress.
Well, like you said, it's a smaller part of women with breast cancer. Like I said, it gets a lot of press. You know, yeah, I can think of probably 3 or 4 celebrities off the top of my head that
Yes,
have been very
yes,
public,
yes.
and many who've elected to have sort of a preventive mastectomy. You know, what are your thoughts? You know, I think it's important people understand just because you have the gene, if you test positive, it doesn't mean you're going to get breast cancer.
It doesn't, but it's a lethal cancer if you do get it.
Yeah.
And I overall I'm not a proponent of mastectomies because it's a pretty barbaric surgery and tough to recover from. So the other 95% of breast cancer patients really don't need to have mastectomies for the most part. A lot of people have them for psychological reasons, not
Right.
medical reasons, because we know that in the other 95% of breast cancers, mastectomies don't actually save lives. But in BRCA positive breast cancers, there is a potential to save women's lives. And however, I don't like young women who have not yet had children or had the opportunity to breastfeed to just jump to have a mastectomy because they learn that they're BRCA positive. So if you're a younger woman of childbearing age and you don't want to have a mastectomy, then you need to have a plan to better protect your cells, but you also need sort of a cancer terrain plan. You need a whole kind of outsmart cancer plan so you can take control of the multiple pathways that help your body be less prone to develop cancer. So then we want to think about things like optimizing vitamin D, for example, and measuring your copper and zinc levels so that we take away growth signals to cancer and optimize cancer immunity. I like to use things like reishi mushroom, Ganoderma mushroom, which is one of the great medicinal mushrooms of Chinese medicine, because like many medicines from nature, it's a multitasker. It does a lot of things, but it is very anti-inflammatory, number one. It also helps to regulate blood sugar and keeping our blood sugar in the low normal range and our insulin in the low normal range decreases breast cancer growth. Some cancers are very sensitive to signals from blood sugar and insulin, the hormone that regulates blood sugar. So we recommend eating a low carb, low carbohydrate, low starch, low fruit, low sweet diet, particularly for breast cancer, is very sensitive to blood sugar and insulin. So again, that's a dietary thing that you can do. So then your diet, your plate looks like half the plate's colorful vegetables, a quarter of the plate's healthy, clean protein, and a quarter of the plate's healthy fats and oils. Notice there's no grain, there's no starch on that plate. So that is kind of a modified plant strong paleo type diet is what that is. And that's an extremely healthy diet for cancer patients. And then when we select our clean proteins, we want some of those to be plant proteins. So that's what the general guideline would be, is to also keep your blood sugar and your insulin low. For all breast cancers, extremely sensitive. One of the other things that's really powerful in breast cancer is body composition. So the more body fat you have, the more you will generate estrogen from your fat tissue, as well as inflammation. So people who have more body fat will be more inflamed and have more estrogen in their body. And so for estrogen driven cancers, which are a large percentage of breast cancers, it really makes a difference to build your muscle and burn your body fat. And as we age, we also want to really maintain our muscle, because actually muscle is part of our immune system and is part of our blood sugar and insulin control as well. And as we age, we tend to lose our muscle mass. And of course, the age demographic for cancers, mostly people over 50. And so that's an age group that's losing muscle mass. So you need to be on top of your protein intake, about 1 gram for every pound of healthy body weight. So that's a lot of protein to try and eat in a day. So I ask patients to try and eat 100 to 120 grams of protein a day. And so you have to have a plan for that. And so these are things which dramatically change your cancer risk, but also just promote your overall health. So these are very important for because so many breast cancers are estrogen receptor positive, meaning that they're sensitive to estrogens. We want to not eat so much estrogen in the diet, so we decrease our animal fats, but because that's where the estrogen is in animal food. So you take away the dairy products and the butter and the cheeses and things like that, and eat less animal flesh, and you'll get less estrogen in your diet. But then you need to be mindful of environmental estrogens, which is just everywhere. So we have plastics will drive estrogen signaling. We have a lot of preservatives like parabens and cosmetics, insecticides and pesticides are hormonal signaling. So this sort of idea of hormone disruptors in the environment is part of the epidemic of hormonal cancers. So these are some of the things that you think about, but that you can absolutely take control over.
Yeah, as an environmental medicine practitioner, it's always scary to look at the statistics on chemicals. The average American gets exposed to 88,000 chemicals a year. Less than 200 have actually been studied for long-term safety. Like I said, a lot of these have what we call xenoestrogens, chemicals that bind to estrogen receptors and kind of mimic estrogen. And the reality is we don't even know what this is doing to our bodies, not just for
That's right.
breast cancer, but for autoimmune disease and heart
That's right.
disease and everything else.
That's right.
It
That's
can
right.
be very overwhelming, but like you said, you can control what you can control.
That's right.
And what you put on your skin, what you put in your mouth, what you use in and around the home, all that really makes a difference.
Well, for women, cosmetics and body care products, think about a lifetime of use, right? And that's a lot of exposure. It might be a little bit at a time, but there are the dyes that are in cosmetics, and then the preservatives that are in cosmetics, and some of the minerals that create color in cosmetics. Can all be toxic. So then you want to be very mindful of the brands that are committed to being safe for ourselves. And then when you think of little girls, the smaller your body is, the more your exposure is in the same room. And so you want to be mindful from the time your children are born, what kind of air they're breathing, what kind of water they're drinking, what kind of shampoo you're using with them, all of that, because it's actually cumulative. And we are seeing, historically, cancer was a disease of people over 50.
Right.
And for the first time in history, we are seeing younger generations developing cancer, particularly breast cancer, colorectal cancer. There are alarming rates of younger people in their 30s having diagnoses. And of course, the epidemic of diabetes and metabolic syndrome, which is prediabetes, is a contributor. What a lot of people don't realize is that diabetes and prediabetes, blood sugar, and insulin issues are a risk for cancer. You have a 40% increased risk of developing cancer if you have blood sugar and insulin issues. So this is part of the dilemma in America of our really unhealthy general population.
Well, as you're saying, I think people have never really thought of cancer as being a metabolic problem.
It is.
It's bad
It is.
genes, bad environment, bad luck. And yet, so much of this is really driven by poor metabolic fitness.
That's right.
And as we get people metabolically healthy, we reduce the risk of cancer and all these other, chronic
That's right.
illnesses.
That's right.
And I like the fact though that the power's with you.
It is.
You
It
don't
is.
necessarily need a doctor to do this for you. It might help to get someone to give you some guidance and some education on how to manage it, but it is something that, the overwhelming majority of people can control.
Well, this is one of the things I say is cancer's not in control, you are. And so when you are diagnosed with cancer, you actually need a team. You need your disease experts who know everything about the kind of cancer you have, but you also need a health team, because you're not going to have the end goal of health when you're a cancer patient unless you have somebody making a plan for your health. And the word health doesn't even come up in a cancer clinic. So
Yes.
it's not like on their minds. And so it's really important when you are a cancer patient that you build a team. And so you have to have health experts on your team that are going to talk to you about all these things we're talking about today and help you and guide you so that you can put your plan together. And for people for whom this is a big lifestyle change and this is more new, then take your time, pick one or two things a week that you change, and then you will, at the end of a year, you'll not only have a new lifestyle, you'll have a new body. So, I often tell patients, we're going to build you a new body. We're going to change by what we put in. We're going to change those building blocks of all your tissues and all your signals that regulate your body so that in a year from now, you're going to be in a different state of health. And so you have to realize this kind of medicine goes in the rhythm of nature, but it's durable. It's really, truly durable. And so, unlike Western medicine, where things change fast, but they're not durable at all because they're not fundamentally changing your function, right? And so that's the power of this kind of medicine. And it is paradoxical, but some cancer patients say cancer is the best thing that ever happened to me because it's such a profound opportunity for self-reflection, evaluation, thinking about your values and your priorities, kind of gives you permission to change and say yes and no to things that you may have wanted to. And, it gets your attention because cancer can potentially kill you. Although most breast cancer patients in the United States today do not die of breast cancer. So we have high rates of breast cancer, but because patients are diagnosed early due to good screening, and I am a proponent of good screening, including mammograms. I'm not opposed to mammograms. And if you get screened, then you get diagnosed early, no matter what type of cancer you have, your chances of survival are enhanced. So you don't want to avoid screening tests. And so most women who get diagnosed with breast cancer in the United States are diagnosed earlier and have very high survival rates. But breast cancer is one of those cancers that if you're diagnosed at a more advanced stage, you may be able to reduce your tumor burden, but not be 100% cancer free. And I call that living with cancer as a chronic illness. And you have to sort of reframe cancer like that as a chronic illness, like as if you had high blood pressure or high cholesterol or diabetes. You're just going to manage it long term. You're going to measure and manage all the time. And you can live decades with a little bit of breast cancer in your body. So you have to realize that that's an option for you, that not to think that cancer is a death sentence, because for the most part, breast cancer is not.
Yeah, well, that's good for people to know, because I know when you hear the word cancer, it's scary no matter what kind it is. Because I think, especially someone who might be a little older, where there was a time where cancer was much more problematic. More people died of
Yes,
all the different types
yes,
of cancers, and
yes,
early detection, better treatments, and certainly better, I say, collaborative care. Integrating someone like
yes,
you, a naturopathic doctor, functional medicine doctor, where
yes,
again, you're going to work on all these things you've just talked about. It's not just, okay, here's your chemotherapy and radiation and you're good. There's all these other things you can do to help support that along the way. And I spent a year when I was a med student actually working at the Cancer Treatment Centers of America in Seattle, and where they integrated conventional and, we'll call it alternative therapy. And the people who did both generally had the best outcomes. The
yes,
people who did
yes,
only one and not the other
yes,
often did not. And this is 25 years ago, but
yes.
I think the concept is still the same.
I think that's a very important point, and I think we should repeat it. So, uh, conventional oncology care by itself is not enough, and naturopathic oncology by itself is not enough. Combining the two is how you get the best outcome. And of course, people who come into our offices are often very anti-medicine.
Yeah.
And so then we have to have that conversation. And I think it's really important for people to understand that we live in a time where we have access to all tools from all different systems of medicine. And so the real question is, what's the best tool for the job for you, for what you have? So there are cancers that are not well treated by conventional oncology, but breast cancer happens to be deeply understood, well researched, and there's ongoing research. And the direction of cancer care is more and more and more individualized. And so what you want to do as a cancer patient is ask for individualized decision making. You want to ask for the most thorough analysis of your genetics and the cancer traits and characteristics and genetics, and make sure you don't just get cookbook standard of care medicine, but that you ask your oncologist to do all of the tests that would lead to individualized treatment. And that's how you get the very best care. And that's not a new idea in conventional cancer anymore, particularly in breast cancer. And so, like, I'll have a young woman with breast cancer might come into my clinic and say, I'm not doing I'm not doing chemo, I'm not doing surgery, I'm not doing radiation. And I'll just say, for my goal for you is for you to live a long life and see your great grandchildren. And so if that's our goal, then let's think about how we get there. Okay, let's think about how we get there, and that maybe chemotherapy or surgery or radiation might have a place. And a lot of people think that chemo or radiation are the enemy. Cancer is the enemy. Okay.
Right.
And these treatments are finite. They're a short window of time in a long life. So if you have to go through chemo for 4 to 6 months, if you live till you're 95, that's not most of your life. And if you're under the care of someone like myself or Dr. Darin, we're going to help you not have as many side effects, protect your healthy tissue and organs, and come out the other side, and you will be okay. You will be okay. So I think it's really, really important to reframe that. And there are a lot of concurrent therapies that we can do from the naturopathic side. We can do IV therapies, we can do mistletoe, vitamin C. I usually put my patients on pretty aggressive protocols of nutritional supplements and herbs. And I'm a very big proponent of acupuncture for managing side effects and dealing with, keeping the digestive function is good and managing any pain or sleep disruptions that happen along the way. But you can manage all of that, and it's really, truly finite. And so it's really good to have someone who can help you think through what are the right combination of therapies, so that actually we don't have this conversation about cancer again in your life. That way it's over. When we do it right, we use all the right tools and it's resolved. And then we have a plan to monitor you by doing specific blood tests for your cancer terrain and your health and your immunity, and that we keep your system in a state of being able to resist cancer. I say you want to create a body where cancer cannot thrive. That's your ultimate goal. And so that is completely doable. It's completely doable. But I think it's important not to reject conventional oncology treatments, particularly in breast cancer.
Yeah, I run into the same issue with a lot of my autoimmune patients, whether it's lupus, rheumatoid arthritis, MS. Again, I get a lot of people who are resistant to medication, but I had I think a very wise doctor when I was a med student tell me, it's like, it's not about what you use, it's how you use it.
Yes,
And
yes, yes.
again, we might want to start with a lower intervention that might be safer, less toxic, but you have to meet the person where they're at. And sometimes you need a higher level of intervention to slow the train down, to get better control, to allow for all these other things. Because again, sometimes diet changes are slower, sometimes changing your immune system is slower. If we're feeling that pressure of having to get control quickly, sometimes this is where conventional heroic medicine can be life-saving.
Well, if you have a lot of tumor burden, your first goal is to reduce that tumor burden, because the more mass of cancer you have in your body, the more cells could potentially swim away from the primary location and create secondary metastatic cancer sites. So that's a reason not to let it linger. It's a reason to have a therapy that works quickly. And it also is a burden to your immune system to leave cancer sitting there in your body. And so we want to reduce the strain on your immune system by reducing the tumor burden. So that's your first job. When you get diagnosed, you want to reduce your tumor burden. That's your absolutely first job. So you can figure out how to do that the most effectively and the most safely. Then, when you have reduced your tumor burden and it's very, very low, then you get natural medicine as a choice. But if you have a large tumor mass, you need more aggressive therapies.
Yeah. You mentioned briefly, and I want to touch on it. I'm someone who lives with an autoimmune disease, and I've read that people with autoimmune conditions tend to have a higher risk of cancer. What's the connection there?
Well, that's only some conditions, not all. And it really sort of matters which tissue is most inflamed by the autoimmune disease. So, for example, we know that people who have autoimmune intestinal inflammation will have a higher risk of colon cancer. So we know that. So it really depends. Like if you have a lot of uh, sunburns, you're at risk from external damage, but the damage from autoimmune disease is internal fire, right? And
Right.
so more certain tissues are more susceptible to that. So We have, for example, if you have autoimmune arthritis, that doesn't increase your risk of cancer typically.
Gotcha.
But some of the modern autoimmune suppressive therapies, because they suppress your immunity, then they suppress the part of the immune system that also fights cancer. So then if you are in that dilemma, you want to just screen appropriately. And many people think about cancer risk. I want to boost my immunity, right? So the immune system has different compartments to it. And so we want to be skillful in what part of the immune system we boost.
Right.
But autoimmune patients are kind of in a dilemma, because if we dial up your immune capacity too much, we can make your autoimmune disease worse. So we have to be careful with the immune tonifying herbs. So when you have autoimmune disease, or if you have received immunotherapy as a cancer patient, which is kind of doing the same thing, ramping up your immune fires, you want to restrict some of the more potent immune tonifying herbs and supplements. So stay away from echinacea, stay away from most of the Chinese mushrooms, stay away from astragalus. These will aggravate the autoimmune inflammation, and also they will aggravate patients who've received immunotherapy for cancer treatment. The one exception to that is reishi mushroom, Ganoderma, which not only is a wonderful immune tonic, but it is also anti-inflammatory. So in smaller doses, you can take it. And this also goes for other cancers where there's a overactivation of white blood cells, which are a part of the immune system, like the leukemias. We want to be careful with this same set of herbs so we don't push up those white cells, which are already elevated in those types of cancers. So you have to be careful, but you can use, there are a lot of the anti-inflammatory supplements and herbs that we use, like the omega-3 oils, the EPA, DHA fish oils, which are very anti-inflammatory, also exert an enormous amount of cancer control. Things like curcumin from turmeric and boswellia from frankincense. These are potent anti-inflammatories that also have a lot of impact on cancer cell metabolism. So some of the things we use in autoimmune disease overlap as good therapeutic agents for cancer patients as well. So you want to be sticking with those things. But the big immune tonics, if you're an autoimmune patient that also has cancer, you have these same restrictions of how you're going to modulate your immune system. So then you can think about things like acupuncture, where you can't get into trouble that way, because acupuncture inherently modulates the immune system, whether you have autoimmunity or your immune system is compromised. So you have to think about carefully what's going on, and because of the age of cancer patients, most cancer patients are complicated, so you could be a cancer patient with autoimmune disease, a cancer patient with diabetes, a cancer patient with depression. So it's always complicated. You have to have good individualized care, and I think that's the problem with just consulting with Dr. Internet. You can get into trouble that way. He's not a very good doctor. So it's good to have a reliable source of information, so you don't actually make yourself worse. But I think there's some basic nutritional things in terms of supplements to think about. So I think about putting a plan together for a patient in a couple of ways. So the first part of my plan will be just the foundation supplements. What are those? So you want to have a good multivitamin, but for a cancer patient, you want that multi to be copper-free and iron-free. And that is because cancer cells utilize copper and iron for their own growth and metabolism. Now, if you're a menstruating woman, you will need some more iron. So that's why you need some individualized guidance. But overall, the multis that are given to cancer patients are iron-free and copper-free. So that's very important. And because we won't talk about women, we're also looking at bone health and bone mineral supplements to prevent bone loss and osteoporosis. Many of those are high in copper. So you want to make sure you're using a bone supplement that's copper-free also. And then we always want to optimize vitamin D. Vitamin D has multiple functions in the immune and cancer setting. And then again, we talk about autoimmunity. Vitamin D is very important to optimize both for the autoimmune patient as well as the cancer patient. And so I like the blood level of 25 OH vitamin D to be between around 75 to 85 for a cancer patient. And that is not possible to achieve with diet or going out in the sun. People go, can't I just go in the sun for my vitamin D? And I go, well, you'd have to run around naked on the equator all day long. So no, it's not. It's not sufficient when you wear clothes all day long. So, and you
True.
live in a northern latitude. So you do have to supplement with vitamin D. If you're going to take high doses of vitamin D, you need to take vitamin K with that to keep your calcium metabolism normalized. And so vitamin D is very, very important. I always put a probiotic into the plan because of the impact of a healthy microbiome on normal immunity, normal inflammation control, and a better response to therapeutic agents. Very important. So I also put in extra magnesium, usually magnesium glycinate. We want to build up our tissue stores of magnesium because many cancer treatments deplete magnesium. And also, we think of, you spoke of cancer as a metabolic disease, which it is. And it is a disease of the mitochondria, actually. So that's our little powerhouse energy supply of our cells, which utilize a lot of magnesium. So cancer patients' fatigue can also be related to magnesium levels because of this need for the mitochondria. So cancer patients tend to need more magnesium. So I always put
Right.
that in. I'll put in a little reishi mushroom usually, and then the omega-3s. So that's like my foundation part of my treatment plan. And then I'll usually put in 2,000 to 5,000 milligrams of omegas. So that's your foundation nutrients. And on top of that, you need to be getting enough protein and fiber every single day, and enough phytochemicals from plants from eating the rainbow. And if you don't do that, then I put a shake into your plan as an insurance policy for your nutritional status, because a lot of cancer patients aren't interested in food. They've lost their appetite, they're tired, they don't feel well, they're fatigued, their digestive tract is bothering them. So a shake is a good insurance policy. And so I'll put in a protein powder and a fiber powder, and usually greens powder as the base of the shake. There's lots of other things you can add to a shake, but that's like a basic shake. If you're not going to eat well every day, all day long, try to have one or two shakes, maybe the days after you have your chemo or you're recovering from surgery. You use a shake as a meal replacement or a supplement to the food you're eating so that your dietary nutrient intake is really optimized, even if you don't feel like preparing food. So that's kind of the foundation. And then the next part of the treatment plan is, what are the targeted agents that we need to put in to manage the cancer terrain? And so there are some basic ones, which I'll mention, and then there are things that are specific to certain types of
Right.
cancer, right? So we always think of curcumin from turmeric when we put together a basic cancer plan. And turmeric has many types of biochemicals in it, the primary being curcumin. So you can cook more with turmeric in your kitchen, but to get a therapeutic dose, you really need to take, at least 1,000 to 3,000 milligrams a day if you actually have tumors in your
Right.
body. But curcumin interacts with over 100 different receptors and biochemical pathways, and there's no drug like that. So if that was a drug, that'd be a blockbuster drug. And it's safe to take long term. It does not interfere with most chemotherapy either, and sort of mitigates some of the inflammation issues that go on. So I'll that'll be in the plan. And for a breast cancer patient, we'll put something that comes from the cabbage family vegetables that's rich in a phytochemical called sulforaphane, and that is known to interact with the development of cancer at every phase of cancer development. And so we'll use something like that. You can eat more cabbage family vegetables, especially broccoli sprouts, and kale to get more of this. And so that's very, very, very important. Resveratrol, which comes from the deep purple and red skins of grapes, and there's a little bit in things like cranberries also, but not much. So those will be things that'll be in there, along with green tea. Although some
Right.
patients will have, there's a subset of patients for whom green tea is toxic to the liver. So I won't always throw that in at the beginning, but green tea, the main phytochemical EGCG from green tea is well researched in cancer and also interacts with many, many pathways in the cancer cell, and also helps you reduce your percent body fat, so and regulate your blood sugar, so it's good for that as well. So I like all these multitaskers, and so that's kind of the basic plan. Those are the basic phytochemicals to put in there. And then with breast cancer, I'll often use a phytochemical called honokiol, Honokiol. That comes from Chinese magnolia bark. It's also well studied and well researched, and it's particularly powerful in controlling the metabolism of cancer cells. So we build a plan like that. We have your foundation nutrients, you have your targeted nutrients, and then you have your Outsmart cancer diet with a shake added into it. So you really get all your nutrients every day. And you have a higher need for protein when you have cancer. So it's really important. The loss of muscle mass is one of the most common side effects of the disease. And it starts
Right.
happening as soon as you have tumor mass. And so you have to really stay on top of your protein. And some people ask me, should I exercise? Should I not exercise? Keep exercising. So exercise is so good for your muscle tone, your muscle mass, your mood, your circulation. Like, just think about it. If you're having an infusion of chemotherapy, you want your kidneys to filter. You want your oxygen to move around your body. You
Right.
don't want to develop a blood clot. So um, you don't want to become a couch potato. You want to stay as active and fit as you can. So if you're already fit and you exercise normally. Just listen to your body. On the days you need more rest. But you don't want to lose your ability to move and be active and fully engaged in your life. You don't want to lose your strength. So you need to keep doing that. There's no reason not to do it.
Exactly. Yeah, I'm always amazed when I hear doctors, other healthcare providers telling people, "Oh, you need to stop exercising for whatever reason." Again, unless you are physically unable
Right.
to
Right.
do it, and even then, often something can be modified to
That's
have
right.
some movement. I mean, I like to delineate movement and exercise. I think we think exercise, well, I can't go to the gym and do whatever, but you could probably still move with rare circumstances. So move where you can. Like I said, it's good for your lymphatics, it's good for your blood. And I think just mentally it's just good to do what your body's designed to do.
I think so too. It makes you feel like you're in life also, I think, when you move. And I have patients, admittedly, they've just gone through surgery or
Yeah.
they're getting aggressive therapy, they're not feeling well. And I say, okay, this is what I want you to do. I want you to take one 15-minute walk 4 times every day and accumulate an hour of movement.
Yeah.
At least do that. I don't care if you walk in circles around your living room or your backyard. I want you to move.
Yeah.
I want you to move.
Yeah. Well, I think you've laid out a great foundation for people for prevention. And if you're in the throes of treatment, some great solid things to start with. And I know you have a program for the public. Can you tell us a little bit about your program?
Well, I call my plan the Outsmart Cancer Plan. And it really is my wish is to share with people what I do with my patients in my private clinic so that you can implement this Outsmart Cancer system. And so you can just get started by engaging with the Outsmart Cancer diet, the Outsmart Cancer shakes, and the Outsmart Cancer supplements. And if you just do that, then you add the lifestyle things in, you'll have transformed your cancer journey. You will have transformed it. So I've tried to make it simple and easy to implement. We have a guide for all the supplements that I recommend at each stage of the cancer journey. Every stage has its unique needs. So we have that as one of the gifts for people. And then I also included, because you're so interested in inflammation, a guide called Cancer Related Inflammation, How to Put Out the Fire. And so we have those two things that really allow people to just get started, stick your toe in the water, make one change, and that becomes self-reinforcing. It'll lead you to make the next change. And don't be afraid to do these things. They're just the things that promote and support health, don't interfere with your cancer treatments. So don't be afraid to take these steps and really take charge, because you as a cancer patient can really have this huge impact on the trajectory and the outcome of your cancer journey, but also how you feel while you're going through it. And I think by taking control psychologically, it helps you to really understand the oncologist doesn't own you, your body, your schedule, your decisions, your choices, that you're the head of the team and all the people on your health team and your disease team work for you and should be listening to you. I think it's really important to have that sense that this is your journey and these are your decisions.
Absolutely. Well, I think for anyone tuning in, if this is something that's on your mind, maybe you have a strong family history of cancer, breast cancer, if you're actively going through treatment, or maybe you're already recovered, you're on the back end of this and you want to help prevent having a recurrence or developing other cancers. I know you've got, a way to connect with people at all levels. And I just think that's really fantastic. So we'll obviously put all the links in the show notes for the program. And I just encourage anyone who's tuning in to take advantage of it. Again, you're really one of the most brilliant people I've met. Such a kind, compassionate, brilliant clinician. And I know that people are going to want to learn from you. So I appreciate
Thank you so much.
sharing this with the communities. And I also appreciate you spending time on the podcast today.